Good afternoon. Welcome to the Thurston County Board of Health special meeting for this Monday, May 16th, 2022. It is 1:01 p.m. My name is Ty Menser. I'm chair of the Thurston County Board of Health. And we have our County Health Officer, Dr. Dimian Abdulmalik. We have our interim Director of Public Health and Social Services, Kurt Harden. We have County Manager, Ramiro Chavez. Not sure what other Board of Health members will be joining us. We are managing this as a Board of Health special meeting in order to be in compliance with Open Public Meetings Act, but this is really not about the Board of Health. This is about a medical provider summit that our County Health Officer will conduct in large part, and I will be listening in, and the other Board of Health members may as well. But with that, I'm going to just pass the baton directly to our County Health Officer, Dr. Abdulmalik.
Good afternoon, everyone, and thank you so much for joining me today. I'm Dr. Dimian Abdulmalik, Thurston County Health Officer. So this healthcare summit will be briefed to the Board of Health on Tuesday, June 14th, 2022. So just to start things off, so we've here in Thurston County, we've been in for a bit of a wild ride with the COVID-19 pandemic, along with other counties and throughout the U.S. As COVID moves from the foreground to the background, I really wanted to take this opportunity to share where we've been, share information about next steps and priorities, and answer questions that we've received from the community, as well as provide an opportunity for healthcare providers to share their priorities going forward. We're so fortunate in Thurston County to have an engaged provider community, and I'm really looking forward to continuing to work with all of you to improve and protect the health of those who live, learn, work, and play in Thurston County. And with that, I would like to turn it over to our County Manager, Ramiro Chavez, in case he would like to say a few words.
Thank you, Dr. Malik, and good afternoon, all of you. Ramiro Chavez, County Manager. I am particularly excited to have this conversation with all of you, leading with Dr. Dimian Abdulmalik, our Health Officer. All of us can attest to the fact for the last 2.5 years have been a little bit of an interesting process, to say the least. We have embarked and responded to the pandemic, and all of us can, again, attest to the fact that looking back, we can always learn as to what we have done and how we could have done better. But that's probably a piece of this conversation today. What I'm looking forward to as to how we move forward as a county, as you as a health providers, with our health officer, Dr. Dimian Abdulmalik. And I believe there's great opportunities as to how we can move forward to enhance and protect the health of our residents here in Thurston County. There's a series of questions. They will be addressed today. Some they have been submitted ahead of time. If we have time, we'll answer the questions that might be placed on right now, but we'll see if we have the time. We only have time for an hour. If you have any additional questions, concerns, my email is open. If you have any questions related to the commissioners, they're attending today, to Commissioner Menser and Commissioner Mejia, please send those questions to me, and I will make sure you get the answers at an appropriate time. Thank you again for joining us this afternoon. And again, myself, I look forward to this presentation and conversation. Thank you, Dr. Ray.
All right. So just to start, I wanted to talk a little bit about where we've been, and welcome you again to this summit. So we've thank you for joining. We've gone through, we've had our initial welcome, so I'd like to welcome all of you again. I wanted to take a few moments and chat a little bit about what a county health officer does, so my roles and responsibilities, take a look back at our COVID-19 experience here in Thurston, look at next steps, and then provide a real-time opportunity for folks to be able to share what some of their priorities are going forward in terms of public health. And then finally, I would like to take a few moments and answer questions submitted by healthcare providers. If there is a question that comes up during this presentation, or if you have feedback, or if there's something you would like to share with us, you can email Meredith Mathis, who's on with us as well and is our Public Information Officer. That email address will be on the last slide of this presentation. And you can also, there will also be a survey form for feedback and questions as well. So, but many opportunities to share your thoughts, as well as your priorities for the future. So, just a little bit about my job. So a lot of my responsibilities are delineated in RCW 70.05.070. And I am appointed by the Board of Health and directed by the Board of Health and the Public Health Administrative Officer. And a lot of my responsibilities really include, knowing and enforcing public health statutes, rules, regulations, ordinances, all of those pieces that are in our RCWs and WACs. A lot of my responsibility as a clinician, so I am a medical doctor, really surrounds the control and spread of infectious diseases, as well as being the physician of record for the Thurston County Public Health Department. So that includes isolation and quarantine, and that includes really being the medical resource for all of our testing activities, vaccination activities, and other medical activities that we do as a health department. Other parts of my responsibilities really include informing the public as to the nature and cause of diseases, so things like COVID-19, but also non-communicable diseases, working with our teams that work on substance use, our teams that work on healthy lifestyle and wellness, as well as our teams working on environmental health. The other parts of my job includes abating nuisances, collecting fees, although that's mostly a delegated responsibility. Really working on our sanitation, so being responsible for sanitation, and then the key piece is taking such measures as necessary to protect the health of the public in Thurston County. So this is a lot of the legal pieces taken from the RCW. The way I really think about my job is I'm the physician for the whole county. That means everyone who lives, works, learns, and plays here in Thurston. I'm responsible at a population level to support their health and well-being. So a look back at COVID. So this basically takes us back from late February up until today. You can see that, so when I joined Thurston County Public Health back in July 2020, you can see what at that time looked like a significant surge. I remember going from 25 cases per 100,000 to 75 cases per 100,000 when I first came. And as we learned, as the pandemic wore on, we had multiple surges, culminating in the most recent Omicron surge at the end of December and the beginning of this year. We've been so fortunate that we have had access to quickly developed vaccines that really reduce morbidity and mortality for folks in Thurston County and around the world. Right now we are on an uptick in terms of COVID-19 transmission, so 386 cases per 100,000 over 14 days. And this is largely driven by Omicron subvariants. The good news is at this time, we are not our healthcare capacity is holding steady, and we're not seeing a significant spike in hospitalizations, but we're watching closely. Some parts of the country and other parts of the world have seen an increase in hospitalizations, but here in Thurston, but we continue to watch for our healthcare capacity here in Thurston. Just wanted to take a note by the numbers. So as of today, we've had 47,888 COVID-19 cases, and unfortunately 414 deaths in Thurston County residents due to COVID-19, as well as 2,274 Thurston County residents who've been hospitalized due to COVID-19. One of the key pieces of our work in COVID really is managing outbreaks and working with folks who have complex settings where COVID-19 transmission is more likely to occur. So as of today, we've had 195 COVID-19 outbreaks in congregate shelter settings, and we're currently working on 15 outbreaks and significant exposures where an outbreak is possible. And this is just in congregate settings. So COVID, as we've seen, COVID-19 is not going away, but because we have COVID-19 vaccinations and other mitigation measures, the severity of disease has significantly reduced. And as we look forward, we continue to support COVID-19 public health measures, as well as look at new challenges. So I just wanted to take a moment and share where we're at in terms of COVID-19 vaccination. So as you can see, so this really looks at, so the light purple is folks that have initiated a primary series. So that's at least one dose. The medium color purple is folks who've completed a primary series. And the dark purple is eligible people who received a booster. So looking at our population in Thurston County, that's 65 and up, more than 96% of folks have received at least one dose of the COVID-19 vaccine, which is excellent. 89.5% have completed that initial series, and 78.9% have received at least a single booster at this point. This overall trends downward into the 18 to 64 age groups in terms of number of folks that have completed a primary series, as well as folks who have received a booster. And then looking at our 5 to 11-year-olds, 36% of 5 to 11-year-olds in Thurston County have had at least one dose of the COVID-19 vaccine, and 32% have completed a series. So we've come a really long way, and we're definitely seeing those benefits in terms of reduced hospitalizations and reduced mortality from COVID-19, but we still have a ways to go. So moving forward. So moving forward, we're working on transitioning out of our incident command structure for COVID response. So we, when the pandemic started, we had an unknown disease. We had an unknown virus that was causing severe disease. And over time, although case counts have risen, the disease severity of each case was significantly reduced. And so moving forward, as we move from an emergency to incorporating COVID-19 into our other communicable disease control activities, there are, we anticipate moving COVID-19 into alignment with other viral upper respiratory illnesses that we also track and support containment of. And so specifically, we just as we do with influenza, we really look at where there's risk of ongoing transmission, so congregate settings, outbreaks, and clusters, really focusing on people who have a risk of severe disease. And even as the emergency moves from the foreground into the background, really continuing to make sure that Thurston County residents have access to testing, quarantine and isolation as needed to keep themselves and their families and all of us safe. We continue to prepare for the next phase of COVID-19 vaccination. So that would be the 6-month to 4-year age group. So both Pfizer and Moderna have vaccinations that they've submitted for FDA review, and we are awaiting those. We are awaiting those results, as well as the results of an ACIP, so an Advisory Committee on Immunization Practices meeting that'll be taking place on the 19th, and other meetings that are scheduled throughout June on this important topic. We also continue to collaborate very closely with local, state, and federal partners. Folks have asked what I've really learned from the pandemic, and I'll have a few more details on that at the end. But one of the key points that I have learned is that we can't do this alone, and that and so the partnership that we've had with our community members, with our healthcare community, as well as others and our colleagues at the state and across the nation, have been really invaluable and continue to be key moving forward. So looking beyond COVID, what are some of the? I wanted to share some of the topics that are on my mind. We've seen during the pandemic a rise in sexually transmitted infections, both in Thurston County as well as around the state, and the CDC has reported on this nationally. Looking at other communicable diseases, so this includes tuberculosis, some of our enteric illnesses, and others. So these are diseases that we continue to investigate case by case, look for trends, and then are based on our discussions with folks who we are reaching out to assist, as well as with community members. We're looking for we're definitely up in the planning stage, looking forward of control of these diseases, as well as other notifiable conditions that we're responsible for. We've seen an increase in substance use and overdoses, and so this is also a new area of focus. We do have the opioid task force, which is incredible, and if anyone hasn't gotten a chance to see the presentation given to the Board of Health last Tuesday, I highly recommend it. Those of us in public health, as well as our colleagues in EMS, as well as our colleagues in the sheriff's office, and our colleagues and our colleagues in the prosecuting attorney's office, came together to share their perspectives on this risk to public health. So additionally, we continue to work on immunizations, not just for COVID-19, but also for other routine vaccine preventable illnesses. Vaccine preventable illnesses are illnesses that are investigated by Thurston County Public Health, and we do provide some support to schools where an exposure has occurred, as well as plan for additional immunization efforts. So more of that to come later in this presentation. We're also looking at community health and wellness. I know that the pandemic has brought on a lot of changes in our ways of living. I know that I myself, especially at the beginning of the pandemic, where I was spending a lot of time at home. My own physical activity declined, but as we're coming out of the pandemic, all of healthy behaviors around exercise and nutrition, as well as other non-communicable diseases are an area of focus. And we've been in an emergency for more than 2 years at this point. So there's a lot of reviewing what went well, what could have gone better for the pandemic, as well as really preparing for the next emergency. So a lot of these efforts, really, we would like to invite all of you to participate in the efforts that are most resonant to you. So in terms of my things that I'm starting, I'm restarting our multidisciplinary infection control calls. These are calls that invite healthcare providers from a variety of settings. So from folks in the hospital setting, folks in the clinic setting, as well as folks, who are taking care of other people in long-term care or congregate shelter settings or school settings, to come together and to both share, Thurston County data, as well as emerging and evolving illnesses, as well as and get a perspective from folks that are taking care of people on the ground. So I'm excited to be bringing these calls back. I also wanted to announce an immunizations work group. So this particular group would invite all folks who are interested in increasing immunizations in Thurston County, and definitely our healthcare provider community, as well as interested community members, folks that work in schools and daycares, as well as members of the public. Other opportunities include sharing healthcare topics and healthcare information. So if there's something that you would like to see featured in a community letter, feel free to send that topic to our PIO. It might take time to address all of our communities, all of the different factors that affect the health of Thurston County residents, but we definitely welcome ideas and perspectives, especially if you see something, that's coming up, where you have multiple patients that have similar questions or a similar problem, or if you're seeing an ongoing need, definitely send us an email and we can see if there's information that we can share with the public that would be helpful. And this is really just a beginning. We anticipate that as we move forward, what I've found is that, once we start moving in these different directions, more opportunities to participate will come available, and we would definitely appreciate folks joining with us in addressing these needs in our county. And with that, I wanted to just take a moment to have a quick poll just to see, what's important to folks. So without further ado, we'll get to the first question of our poll, which is which foundational public health services are a high priority for you? And this includes the 6 foundational public health services identified by the State Department of Health. So maternal, child, and family health, chronic disease and injury prevention, vital records, communicable disease control, environmental public health, and access to clinical care would be the first one. There's also a poll about folks receiving public health services in the past year, and then which public health service was received. So looking at vaccination and testing, septic inspection or assistance, rent assistance, working as a client or as a provider, providing referrals to the Nurse Family Partnership Program, TB treatment, food inspection, disease investigation of a notifiable condition, technical guidance for disease spread and prevention or other. And then really looking at what your patients and clients need in terms of foundational public health services. And the last one is absolutely critical for the opportunities that we shared in the previous slide. So really, really asking, what's the best way for you to receive information about public health, whether it's through our CD updates, our website, email, social media, letters to the community, or meetings and webinars. And if there's anything that you would like to provide more detail on, please feel free to email our PIO, or there will be a form where you can provide more detail at the end of the summit. So I'm just going to give a few more moments for folks to fill out the summit poll. Meredith, are we ready to share results?
Yes, I will share those just a second. So I don't think anyone on the live stream is able to see the poll or the results. So this is something that right now only the Zoom participants can see.
Okay. So in terms of foundational public health services, 58%, 58% of respondents said that they were most concerned about maternal, child, and family health. 42% said they're most concerned about chronic disease, injury, and prevention. 8% said vital records. 67% said communicable disease control. 33% said environmental public health, and 83% said access to clinical care. So, so this is definitely very helpful for us moving forward. In terms of folks who've received a public health service in the past year, 92% of respondents had, and 8% of respondents hadn't. 67% received a COVID-19 vaccination, 42% received COVID-19 testing, 8% received septic inspection or assistance, 8% received TB treatment, 25% received or worked with disease investigation of a notifiable condition, 25% received technical guidance for disease spread and prevention, and 8% had another service that wasn't listed. In terms of what foundational public health services are most important to your patients and clients, 92%, this is striking, stated access to clinical care, followed by 33% affected by communicable disease control, and 33% chronic disease and injury prevention, as well as 25% each of maternal, child, and family health, and 25% that stated environmental public health, and 8% stated vital records. In terms of preferred ways of receiving public health information, email was by far the most preferred at 75%, followed by communicable disease updates and health alerts at 67%, followed by social media and meetings or webinars at 50% each. Website 17%, and letter to the community was also 17%. So thank you so much for taking a moment to share what's important to you and the best ways for us as a public health department to reach out. And now on to questions that we've received from the healthcare community. I'm going to ask our county public health officer, this public information officer, sorry, Meredith, to go ahead and share some of the questions that we've received, and then I'll be able to answer them. And just remember that if there's anything additional that comes up, any additional questions that you have, please feel free to either email Meredith at tcphss.pio@co.thurston.wa.gov. That's on the last slide of this presentation, or fill out a feedback form. And with that, I'll hand it over to you. Thank you, Meredith.
Thanks, Dr. A. Give me just a second here to pull this up.
Yeah, just a point of clarification, we have been able to live stream the survey results. So anybody participating or observing the live stream have been able to see the survey results. Thank you.
I apologize. It'll be just a minute.
Just 1 second. I apologize. So thank you everyone for your patience. So we did put out a request, just for background, we did put out a request for questions last week. And many folks responded. So these questions really reflect what we've been hearing from our community. And with that, I will turn it over to Meredith. Thanks.
Thanks for your patience. Sorry about that. It took me a minute to find them. The first question we received from the community providers: what is the plan for childhood immunizations, and what has public health done to prepare?
Yeah, this is a question that I hear all the time. I know that there's a lot of interest in childhood immunizations here in our county, which is incredible. So thinking about what our planning pieces are. So we of course have been working on COVID-19 vaccination planning, but we're also working on back to school immunization planning. The first step in terms of that short-term planning piece is an invitation has been sent out to vaccine providers in our county to meet in the next few weeks to look at what folks' plans are regarding back to school immunizations, as well as what challenges people are facing. This helps us see what our internal county capacity is, as well as shows us what we might be able to do to help facilitate vaccinations moving forward. If there's a practice, or if somebody has a practice that is interested in becoming a vaccine provider, please feel free to reach out to us, and we will connect you with the appropriate folks with the Office of Immunization. We're really fortunate in Washington State to be able to have the Washington State Childhood Vaccine Program that actually distributes vaccine to enrolled providers free of charge to ensure that folks have access to low and no cost immunizations. The role really, when we're looking, so short term, we're meeting with our providers in the coming weeks to see what capacity is and to see where we can help and what the challenges are and the anticipated challenges may be. In addition, we're in the planning phase of our own vaccination efforts. So as a county public health department, we really work on looking and seeing where there are gaps, and then working to address those gaps where possible. So seeing, are there folks that don't have access, thinking about why they might not have access, and then attempting to, and then doing our best to facilitate access. So we are looking at different sites throughout our county where we might be able to support back to school immunization events, as well as continuing to partner with our Medical Reserve Corps that have been really instrumental in immunizations for a long time in our county. Looking forward, and in terms of that forward planning, we are working on the position of an immunization coordinator for our county that would be taking point in these efforts. So we've got short-term plans of seeing where we're at in the county, longer-term plans in terms of seeing where and how we can fill gaps and support immunizations, and then the longer-term plans of an immunization coordinator that would take place.
All right. Second question we have: will PHSS continue to provide any COVID services, such as vaccinations and testing, after the COVID response ends?
So that's a great question, and that was actually that's a question I also get a lot, and it's a tricky one to answer, and that's because there's a lot in flux. So in terms of as we plan for COVID after June 30th, 2022, there are a number of planning scenarios. What we do know is that over time, COVID-19 is going to be incorporated into our normal disease control operations, and that as some specific aspects of COVID-19 services end. At some point, we will likely be transitioning from the mall site to more mobile clinics and vaccination events. Things like our testing locations. Over time, we anticipate transitioning to supporting access to testing, as well as over the counter tests as they're available to us. And then, of course, working with community partners, whether it's through collaborating on specific events, coordinating a list of resources to help folks with, as well as coordinating resources for COVID-19 mitigation in general, as well as test kit distribution as we're able. So in general, this is a dynamic time in the pandemic. There are a lot of unknowns, but overall the movement is towards supporting folks in terms of accessing care in the community, providing necessary gap services, as well as coordinating and receiving feedback from our community partners moving forward.
Okay, our next question. Where can underinsured and uninsured individuals access vaccinations, testing, and treatment for COVID?
So right now, vaccinations, folks can access vaccinations at our mall clinic or at any of our vaccination events throughout the county, as well as through federally qualifying health centers, as well as pharmacies and healthcare providers. COVID-19 testing at this point is available through our community-based testing team. We also have distributed, so since mid-February, we've distributed more than 20,000 over-the-counter tests to community partners, just to ensure that folks have access to tests, even if buying them even if buying them in the store may pose a hardship. Additionally, another concern that folks have had is about COVID-19 treatments. Of course, treatments are prescribed by healthcare providers, and I wanted to take a moment to point everyone towards the U.S. Department of Health and Human Services that has a great page, which is listed on the last slide of this presentation. And basically it shares resources for folks who might require testing. So HHS has partnerships with different pharmacies and groups, including CVS and Walgreens, where specific services are accessible. So if folks are wondering, how can I access a COVID-19 test, or how can I access vaccination, that is also a good place to start, in addition to our federally qualifying clinics, as well as the services that we provide at Thurston County Public Health.
Okay, question number 4. How does Thurston County Public Health and Social Services make decisions about what health issues to prioritize?
So this is a really great question. So a lot of our efforts are legally required, and this includes a lot of our disease control and prevention activities, many of our environmental health and vital services responsibilities, as well as many others. So we're also responsible when we think about, our mission, which is to serve and protect and promote the health of all residents in Thurston County. We also really think about things that are termed foundational public health services, which are the services that can really only be provided by a public agency. So that also takes priority. So things where really that only we do are things that of course we value. Where we absolutely appreciate our community partners, and we enjoy working with them just because people in our community provide specialized care as well as prevention and promotion activities beyond what a single agency beyond the single agency approach. So definitely there's a collaborative piece in what we do. Priorities are also really informed not just by things that only we can do, but also by data and assessment. So this data comes, of course, we get CDC federal data, state, as well as our own local data. So some of which we share at Board of Health meetings. And then the other key piece, and this is where this is where all of your help is appreciated, is in identifying demonstrated needs in our community. So we see a lot through data. We see a lot in our conversations with people. We have meetings with stakeholders, and we hear, we hear what people are struggling with, and all of that together. So the parts that were legally, that are part of our legal guidelines, the parts that's work that only we can do, the parts that are informed, that are data informed and population driven, from data at all levels, as well as information and perspective shared by our community members at large. So as we continue to protect and promote health in Thurston County, I'm really excited to have to continue to have opportunities for collaboration and build on meetings and work groups, as well as those already in place. And so we're excited. We're excited to not just to be able to focus on a wide range of issues that affect folks in our county, and take a very community informed approach as well.
Our next question. I am hearing a lot about H5N1 and pediatric hepatitis cases. What can you tell me about these emerging diseases?
Yeah, so H5N1 is a high pathogenic avian influenza virus. There have been identified flocks in multiple counties in Washington state that have tested positive for this disease. And there's been one reported case of human transmission in the US at the end of April. Good news is based on report, that person has recovered. We haven't seen person-to-person spread. So that risk, the CDC rates that risk is very low. Symptoms are consistent with what's typical for influenza-like viruses, but key information is to make sure to wear full PPE. So aerosol droplet contact PPE for these patients, much like you would for a COVID patient. So the other key thing is that if a case is suspected, definitely give us a call at Thurston County Public Health, and we can facilitate testing because testing occurs at the state lab. And if you have a concern, consider treatment with antivirals for suspected cases. So I know this is a lot of information, but I have a link to the HAN alert from CDC that provides a lot more detail on the last slide of this presentation. As far as the pediatric hepatitis cases, that's another emerging disease that we've been hearing about in the media as well. So at this point in time, CDC and state partners are investigating 109 children with hepatitis of unknown origin across 25 states and territories. So we don't know yet what causes this, but about more than half of them have tested positive for adenovirus, and there's some suspicion that adenovirus type 41 may play a role in this illness. So if you're seeing a child that has hepatitis, which is inflammation of the liver, and there isn't another explanation for it, consider adenovirus testing. And if there's a concern, again, reach out to us. There's some specific guidelines in the HAN alert, including, using whole blood testing rather than plasma for PCR, and a few other tips and tricks that the CDC has shared. Another request is a data request from the CDC, which is if you have hepatitis cases of unknown etiology in children under 10 that have specific biomarkers, CDC is just requesting an email with those cases, and this is for cases dating back to October 1st, 2021. So this is an emerging illness, we're still learning more. It's still, at this point, it's being investigated in 109 children in U.S. states and territories. And if your facility or you need assistance, guidance in terms of testing, what tests to run, if you are worried that you may need the use of the public health lab, honestly, just reach out to us, and we'll be able to point you in the right direction.
Okay, I think we probably have time for one more question on our list. What are best practices for calling in a notifiable condition?
So this links directly to some of the conditions that we just talked about, but you can definitely call our front desk, 360-867-2500 during business hours for immediately notifiable conditions. And these are conditions where if you see it or suspect it, you need to talk to a live person. That is how to get in touch with a live person during business hours. After hours, call 1-800-986-9050, and this is for healthcare providers to report a notifiable condition. For other notifiable conditions, that are not immediately notifiable, call 360-786-5470 or fax us the disease report, which is usually a lab result. We check this line every 60 to 90 minutes during business hours. So we're usually pretty good about getting back to folks within a couple hours of leaving a message. And we might have follow-up questions. We might, every so often, we'll be requesting a chart or something like that to provide further context as we investigate and support folks in our community who are experiencing illness or are at risk of transmitting disease to others. So those are the critical ways to get a hold of us. I did want to take one moment to answer one additional question that I keep getting, and so I wanted to answer the question of what have I learned during the pandemic. And while I know that we've all learned and grown over the course of the pandemic, I wanted to share that the key thing that I've learned is that we are all in this together, and that I have been really impressed with our community partners, with folks in the healthcare community who've reached out. So when people have had, different presentations of COVID, when people have had questions, the fact that folks, have reached out to us and let us know questions and concerns. I've been really impressed by by my colleagues, throughout the county, as well as my colleagues, both from other local health jurisdictions in the state, in the way that everyone looks at the data that we're seeing. So whether it's, a study or, population level data, comes together, interprets it, looks at best practices, and tries to be in the way everyone has been so thoughtful about supporting, the health and well-being. My responsibility is first and foremost to those who live, learn, work, and play here in Thurston County, but being able to work with and share ideas and insights with people across the state and across the country has been invaluable. So we've learned a lot about, collaboration, the nature of data-informed population-based public health, responding in an emergency, as well. I've also learned a lot about the strength of our community. And with that, I would like to say thank you, everyone, for participating in this summit, and I am looking forward to your feedback and questions. Thank you so much, everyone.
Commissioner Mensah, back to you to close the meeting, please.
Okay, great, Dr. A. Thank you. Kurt, anything you wanted to add before we go?
Yeah, first of all, again, thank you to everybody who's here on the Zoom call, and also to everybody who's watching on the county YouTube channel, because I know this is being streamed live, and also that this will be posted so that people can participate in the follow-up survey. All the providers who are on the county YouTube channel will be able to participate in the follow-up survey, as well as those who weren't able to watch this afternoon but can watch the tape recording later.
I'll just close by thanking everyone. There's a lot of changes coming as we've got COVID-19 ramped down. We've got a new incoming director of public health at some point. We have the expansion of the Thurston County Board of Health this summer. That's a lot of opportunities to get input from the medical community. So I'm glad we kind of got this, start building these relationships, get this input coming. The commissioners always value the input we get from our medical community. And with that, we're going to close this meeting, and that's it. Thank you.
Thank you.